Hi, my name is Rachel Bolognese, and I'm presenting my thesis titled Disparities in Breast Cancer Treatment, Improving Mortality Rates and Addressing Inequalities. This is a presentation for my thesis presented to the Commonwealth Honors College of the University of Massachusetts Amherst. This is in partial fulfillment of my requirements for the degree of the Honors Bachelor of Science in Biology. So my thesis revolves around preventative medicine of breast cancer. In order to begin, it is important for a crash course of breast cancer and how it works. So breast cancer is a disease of the breast duct in which cancerous cells form based on whether exposure to carcinogens or environmental problems, as well as mutations and genetics play a factor into the formation of cancer cells in the breast duct. There are multiple stages, as you can see, similarly to other cancers, beginning with stage 0, which is called DCIS, non-invasive ductal carcinoma in situ. This is when the cancer cells have not spread to the breast tissue yet. They are contained in the breast duct. This is the easiest form of breast cancer to treat. It is not invasive and it is pretty easy to target. And then once the cancer in the breast tissue once the cancer in the breast duct has spread to the breast tissue, the tumor is now formed in the breast tissue. This is stage 1. This is invasive ductal carcinoma. And now we have invaded from the breast duct into the breast tissue. Stage 2 is still contained to the breast tissue. The tumor has only grown in size. And then we get to stage 3, in which the tumor continues to grow in size, but is now spread to the axillary lymph nodes. This is the precursor to stage 4, which is metastatic breast cancer, in which now the cancer has spread from the breast to other organs through the bloodstream. The 4 major organs that breast cancer spreads to are the brain, lung, liver, and bone. This is the least treatable form of breast cancer with the highest mortality rates. So the importance of preventative medicine is that breast cancer is treatable if caught early enough. So as stated before, stages 0, 1, and 2, the breast cancer has not spread to other parts of the body. It is contained within the breast, which means that surgery, targeted therapies, they're very easy to treat this. And usually the survivability rates are much higher, anywhere between 85 to 98%. The prognosis is very good for patients diagnosed in these early stages because it is very easy to treat, and they have a lower incidence of reoccurrence of cancer. However, once we enter stage 3 and 4, when the cancer has now spread to other parts of the body, the rates of survivability drop. They can be anywhere between 30 to 70%. That 30% is more likely to be in stage 4, considering once the cancer is spread to other organs, it is very difficult to treat and the prognosis is very, very, very poor. So if we can stop breast cancer from spreading to stage 3 and 4 by catching it early, we can prevent this mortality. So to catch breast cancer early, we go through mammograms and annual checkups. Mammograms have been found to reduce breast cancer deaths by 20 to 40%. This is significant considering that mammograms can detect breast cancer very early on, and depending on a patient's history and their interaction with their primary care physician from annual checkups, they can determine whether or not they want to go through a treatment. Annual checkups can alert women if they have risks, such as BRCA mutations or family medical histories. These are all risk factors that increase a woman's chance of developing breast cancer. So the American Cancer Society recommends that women with these risks get annual and biennial mammograms, depending on their treatment plan with their physician. And this can catch breast cancer in the early treatable stages, such as stage 1 and 2, if mammograms can catch it. So the main focus of preventative medicine is that it's easier to treat a disease before it becomes too dangerous and too risky. So if we catch breast cancer in these early stages before it spreads to the rest of the body, we can significantly increase survivability rates, and breast cancer can be easily treated through certain therapies. The problem, however, is that not everybody has the same access to these preventative measures, such as mammograms and annual checkups with a primary care physician. People with lower socioeconomic statuses in the United States have less access to these aspects of healthcare. They are less likely to have health insurance. They are more likely to be in environments where they cannot access certain parts of healthcare, such as exercise, food. These are all aspects of healthcare that can prevent certain diseases, all diseases really, including heart disease, other types of cancer, but specifically for this topic of the thesis, it is breast cancer. So the problem is that because people in lower socioeconomic statuses cannot afford to have these preventable measures of healthcare, we get the statistics in which they're more likely to die from preventable diseases such as breast cancer. Significantly, a statistic found is that white women are more likely to be diagnosed with breast cancer, while Black women are more likely to die from it. This is because Black women make up the highest percentage of poverty rates in the United States at 25.8%. They also make up a high level of uninsured rates, with Hispanic Americans taking the highest spot in uninsured rates. And Black Americans have the lowest life expectancy out of demographics in the United States based on year. This is due to years of systemic racism building up in the United States that has caused redlining to put Black Americans in lower income communities in which they have less access to education based on how important preventive medicine is, as well as less access to healthcare in general, considering they are less likely to have insurance and they are more likely to be have higher mortality rates of breast cancer, considering here, based out of 100,000 women, Black American women made up the highest percentage of population-based mortality rates. This is significant because the health insurance, without health insurance, patients have to pay prices for treatment out of pocket, which is a conundrum, considering that if they do not have enough money to pay for health insurance, they're not going to have enough money to pay for treatments, considering breast cancer treatment costs on average $20,000 to $100,000 per patient. The average cost of mammograms is between $100 to $250 a year based on the recommendations of the American Cancer Society. Surgery, once breast cancer is diagnosed, costs between $10,000 to $13,000 for a double mastectomy. And chemotherapy, once breast cancer is also diagnosed, is between $23,000 to $65,000 per patient. This is why 3.1% of breast cancer survivors declare bankruptcy, because they are unable to pay these prices. A third of cancer survivors have gone into medical debt and have struggled to pay back their bills, which results in this overall, that lack of insurance leads to delay in seeking care, because without insurance, patients are less likely to go for preventative measures of diseases until they are really suffering from a disease. This is why 6.6 million Americans are uninsured with chronic conditions, and they're unable to treat them because they do not go in for certain preventative treatments. Specifically with breast cancer, women in poverty that do not have health insurance are not going to go for an annual mammograms. By the time they do go seek care, it is because they are suffering greatly from the disease, which means that it's likely that breast cancer has already spread to the rest of their body. So possible solutions, I propose that we create more outreach programs. If the public is educated on how important preventative medicine is, they'll be more likely to seek out annual mammograms or seek out affordable options to getting preventative checkups. Also, I did not touch upon drug prices in this video, but increasing government involvement in the regulation of drug prices is important, because the reason that healthcare and chemotherapy cost so high for breast cancer is because of the prices set by private manufacturers for chemotherapy drugs. I also propose that we decrease deductibles for health insurance. There needs to be a way for health insurance to be more available to people in poverty. There are public health insurance programs such as Medicare and Medicaid. However, there's still a very, very high proportion of Americans that are uninsured. And this leads to a delay in seeking care. Also, increasing awareness, which ties into the importance of this issue. Inequalities should not lead to higher death sentences for diseases. A woman in a lower income situation should have the same access to preventing breast cancer as a woman in a higher income situation. Healthcare should be more accessible for these people in these impoverished communities, as well as certain aspects of the social determinants of health, including food security and exercise. Poverty should not indicate whether or not you survive a disease. However, that seems to be the case in a lot of situations here in the United States. Thank you everyone for watching. And for any questions, please email me at rbalanici@umass.edu. I'd be happy to answer any questions you have about this. I'm very passionate about this topic as I am entering the healthcare field myself after graduation. But thank you everybody for watching, and I hope that we can raise awareness on this issue. And here's my bibliography just for references. I'd be happy to provide more references as well if you have any questions. Thank you very much.